Most nursing students fail fluids and electrolytes for the same exact reason. You're trying to memorize your way through the signs, the symptoms, and the nursing care. That will never work. The secret is not trying to know every possible fact. It's knowing how to think about the facts. Let me show you how that looks with some real NCLEX-style practice questions on fluids and electrolytes. Question number 1. A client with type 1 diabetes is admitted with diabetic ketoacidosis, DKA. Which of the following interventions should the nurse anticipate as the priority in managing this condition? A. Administering intravenous regular insulin. B. Providing oral glucose. C. Encouraging oral fluid intake. Or D. Administering sodium bicarbonate. The correct answer to this question is A. Administering intravenous regular insulin. But this is a great example of why you can't just memorize your priority nursing actions. And that's because the correct answer always depends on what the question is asking and which options they choose to present to you. In real life, the priority nursing action for DKA almost every single time is going to be fluid resuscitation. Your textbook will say it, your teacher will drill it into you. It's going to be the first action you take when somebody comes in with this condition. And you have to understand the reason why, so that if you're not given that option that you memorized, then you can still think like a nurse through the other answer choices to decide what would be the next best thing to do. They are always testing you on how to think like a nurse with these questions. They are not testing you directly on if you know the nursing facts. That's why they try to trick you. The reason why fluid resuscitation is the number one thing to do is because when you have DKA, your blood sugar is so high that your kidneys are trying to filter it out. They are just throwing blood sugar into your urine. However, blood sugar is stuff. And if you saw my previous video on the 4 secrets of fluids and electrolytes, then you know that when stuff leaves the body, water follows. It's simple osmosis. If a lot of stuff leaves the body, a lot of water is leaving. And this client is severely dehydrated to the point that circulatory collapse, low blood pressure, this is a serious concern. It's what will kill the client the fastest. It's also what makes option 3 a tempting distractor. Because if you memorized, we need to do fluid resuscitation, but there's no IV fluid resuscitation available as an answer option, you might second guess yourself and get tricked into choosing oral fluid intake. But that is not going to be fast enough to solve the problem. There is a better answer. You might also be tricked into thinking option D is correct because administering sodium bicarbonate is also something we would do. This client has ketoacidosis. If you've studied ABGs, you know this is a form of metabolic acidosis. And one way we can treat that is with sodium bicarbonate, which is a base, which counteracts some of the acids. But this also is not the best answer because there's a better answer. And the better answer is administering intravenous regular insulin. The reason why is this is really the second thing we would do after fluid resuscitation. Fluid resuscitation is dealing with the symptom that would kill the client the quickest so we can keep them alive long enough to deal with the root cause. Administering IV insulin is dealing with the root cause. We know that diabetic ketoacidosis is going to be happening because the patient is not getting enough insulin. So the blood sugar accumulates in the blood. We can correct that by giving the insulin, which allows the blood glucose to be taken into the cells where it's needed. And that's what makes A the best answer choice. Tell me in the comments, did you learn something new from this? Question number 2. A client with chronic kidney disease presents with muscle cramps, confusion, and a positive Schroetex sign. I can never pronounce that, can you? Which electrolyte imbalance is most likely responsible for these symptoms? Here's another question where you might have memorized the symptoms and you might think you know what electrolyte imbalance this is. Let's see if you're right, because I think I'm going to show you a better way to answer this that does not rely on memorization. Answer A, hypernatremia. B, hypocalcemia. C, hyperkalemia. D, hypomagnesemia. The correct answer to this question is B, hypocalcemia. Now, you might have memorized these symptoms, especially Schroetex sign, and said, haha, I know that's hypocalcemia. The problem is if you only memorized the symptoms of hypocalcemia without understanding why they occur, you risk 2 major problems. 1, you don't have the memory hooks to confidently answer on test day. You're more likely to mix it up and wonder, ooh, was that hypocalcemia or hypercalcemia? Or was that a different imbalance altogether, and you might end up changing your answer. The other major problem is with long-term retention. Simple memorization does not have as good a long-term retention as understanding and active learning strategies do, which means that even if you get this question correct now with memorization, you're going to struggle with this question on NCLEX because the memorization did not stick with you long-term. Let me explain why these symptoms happen because it's the same reason for all of them. That's what makes my way of studying easier, by the way. A quick review of anatomy and physiology will remind you that calcium has an important role in muscle contraction, specifically when it comes to action potentials. This is how a lot of cells in the body are triggered to fire, whether it's muscles or neurons. And when there is less calcium, those action potentials are easier to trigger. This explains the muscle cramps and the positive Trotek sign, because they're both kind of forms of tetany or inappropriate muscle contraction. Those muscle cells are getting triggered too easily because there's not enough calcium. The confusion is the same reason, just a different location. It's because the neurons are also getting triggered too easily as a result of the low calcium. And when your brain cells are getting triggered, they're not working properly, you're going to experience confusion. But not you, because now you will never forget. Number 3, a client is admitted with severe diarrhea. The nurse anticipates which of the following lab results to be consistent with this condition. A, elevated blood pH. B, decreased bicarbonate, HCO3. C, increased partial pressure of carbon dioxide, PaCO2. Or D, elevated blood urea nitrogen, BUN. The correct answer to this question is B, decreased bicarbonate, HCO3. It's not enough to memorize the signs and symptoms of acid-base imbalances to be able to answer this question, because it doesn't even tell you what acid-base imbalance this client has. Instead, they give you symptoms, and you have to understand how these symptoms would affect the acid-base imbalances in the body. And once you understand that, then you can predict what we expect to do about it, or what other signs and symptoms we would see as a result. In this case, it again comes back to A and P. The lower part of the digestive system releases base to neutralize any stomach acid that enters the intestines as part of the digestive process. We don't want acid in our intestines. That would be painful and it would tear up our mucosa. Now, when you have severe diarrhea, that means you're going to be getting rid of that very quickly. That decreases the bicarb, which increases the amount of acid. And when we increase acid, that decreases pH. This is what I call mental gymnastics. If you can use scratch paper for your ABG tests, I always recommend it. But A cannot be correct because we would expect a more acidic pH, which would be a lower pH. So we can cross that out. In any case, since we're basically pooping out bicarb, we would expect there to be less in the body. Therefore, the blood levels of bicarb are also going to be less. And this client is likely to be experiencing metabolic acidosis, which is the opposite of what they are losing. Question number 4. A client is receiving intravenous fluids postoperatively. The nurse notes that the client's urine output has decreased significantly. Which of the following assessments should the nurse perform first to evaluate the client's fluid status? A, measure the client's blood pressure. B, assess the client's skin turgor. C, review the client's electrolyte panel. Or D, check the client's lung sounds. The correct answer to this question is A, measure the client's blood pressure. The reason why comes back to something as simple as hydrostatic pressure. Post-operatively, we would not expect the urine output to decrease if they are receiving IV fluids. This indicates a possible problem. In order to help identify if there's a problem and what the problem is, the blood pressure is the fastest way to check fluid volume status inside the blood vessels. If the urine output is being caused by a low volume in the blood vessels, then the blood pressure would be low. Now, we don't expect that, though, because they are receiving IV fluids. So it's possible the blood pressure could be high, indicating that the patient is receiving the fluids, but for some reason, the kidneys are not processing and getting them out. Either way, it's valuable information that we need to convey to the healthcare team. Some students may be tricked into thinking answer B is the option, because if somebody is having decreased urine, they may think that's a sign of dehydration. And if we have dehydration, we would expect to see evidence in that in the skin turgor, perhaps like some skin tenting or something like that. However, that is not as direct a way to measure it as blood pressure, and it's also not going to show up as quickly as the blood pressure will. Are you starting to see how much easier it feels to stop memorizing and actually think through the question and understand it? But it's still a little scary, right? Especially when you have to go through that mental gymnastics, because it forces you to trust your brain. But that's exactly what you're going to need to do for the rest of your nursing career. So don't give up now. Subscribe to this channel, hit the like button, and then watch the next Fluids and Electrolytes video to make sure you've got everything you need to master this tricky topic.